over the next few years, my children and millions of their peers will start down the path to adulthood. Each of their paths will be different. All will be filled with challenges along the way. But it's these challenges that I want to talk to you about today, because I'm deeply concerned as a parent and as a doctor that the obstacles this generation of young people face are unprecedented and uniquely hard to navigate, and the impact that's having on their mental health is devastating. There are a number of long-standing preventable factors that are driving this crisis. The recent ubiquity of technology platforms, especially social media platforms, have had harmful effects on many children. And meanwhile, progress on the issues that will determine the world this generation will inherit, like economic inequality, climate change, racial injustice, LGBTQ rights, the opioid epidemic, and gun violence, feels too slow. It's undercutting the fundamental American promise for many of our children, their hope in the possibility of a better future. All of these factors affecting youth mental health were true before the COVID-19 pandemic, but the last 2 years have dramatically changed young people's experiences at home, at school, and in their communities. It's not just the unfathomable number of deaths or the instability, it's also the pervasive sense of uncertainty and the nagging sense of fear. It's the isolation from loved ones, from friends, and from communities at a moment where human support systems are irreplaceable and more needed than ever before. But at the heart of our youth mental health crisis is a pervasive stigma that tells young people they should be embarrassed if they are struggling with depression, anxiety, stress, or loneliness. It makes a human condition feel inhuman. But senators, we are on the verge of beating back one public health crisis in COVID-19 only to see another grow in its place. In 2019, the year before the pandemic, 1 in 3 high school students reported feeling persistent feelings of sadness or hopelessness, up 40% from a decade prior. From 2011 to 2015, youth psychiatric visits to emergency departments for depression, anxiety, and behavioral challenges increased by 28%. Between 2007 and 2018, suicide rates among youth aged 10 to 24 increased by 57%, a total of 65,026 young people lost. As devastating as these numbers are, the real tragedy is that we are failing as a country to adequately respond to them. Even before the pandemic, we were not doing enough to provide adequate care and treatment options in every community. And COVID-19 has only made that disparity worse.
Hi everyone, George Stephanopoulos here. Thanks for checking out the ABC News YouTube channel. If you'd like to get more videos, show highlights, and watch live event coverage, click on the right over here to subscribe to our channel. And don't forget to download the ABC News app for breaking news alerts. Thanks for watching.